Hi JCAC community, welcome back to our channel. My name is Mikayla Minehart and I'm an Associate Professional Counselor here at JCAC. In today's video, we are going to discuss postpartum depression. If you're a new mother or love someone who is, this video could have helpful information for you. First, let's talk about postpartum depression versus the baby blues. So what is postpartum depression? Postpartum depression, or PPD, is a mood disorder that occurs shortly before or soon after childbirth. PPD refers to the depression experienced from the combination of hormonal changes, psychological adjustments, and the fatigue that comes with being a parent to a newborn. PPD occurs in roughly 10 to 20% of mothers. Unfortunately, people often dismiss PPD as the baby blues. Most mothers experience the baby blues for 1 to 2 weeks after giving birth. Baby blues refers to the mood swings, the not feeling like taking care of yourself because you're so exhausted, and feeling irritable and overwhelmed. When these depressed feelings last longer than 2 weeks, you may be experiencing PPD. Symptoms of PPD include depressed mood or severe mood swings, difficulty bonding with your baby, withdrawing from family and friends, overwhelming fatigue or loss of energy, intense irritability and anger, hopelessness, increased or decreased appetite, feelings of worthlessness, shame, guilt, or inadequacy, reduced interest or pleasure in activities that you used to enjoy, or recurrent thoughts of death or suicide. If you are experiencing these symptoms and want to do a self-evaluation, the Edinburgh Postnatal Depression Scale is linked below in the description. This is an assessment tool that can help you determine whether or not you may have PPD. A score of 13 or higher indicates a depressive episode and means that you should probably follow up with your healthcare provider. So let's look at postpartum depression versus exhaustion. Postpartum depression can easily go unrecognized by mothers themselves. Most mothers find themselves feeling overwhelmed and sleep deprived simply by caring for their newborns. It is easy to dismiss symptoms of PPD and write it off as exhaustion. Distinguishing between sleep deprivation and postpartum depression can be difficult, especially as one condition can aggravate the other. A good way of determining if this is depression or exhaustion is how it feels to be with your baby. An exhausted mother can still feel joy when she hears her baby laugh or coo. A mother with depression may find it hard to feel joy or bond with her child. Please note, this does not mean that you are a bad mother or a bad parent. It only means that your body and mind need support and you are a good mother by asking for help. There is a negative stigma around postpartum depression due to extreme situations shown in media. Many people confuse postpartum depression with postpartum psychosis. Postpartum psychosis occurs in approximately 0.1 to 0.2% of births, and it's extremely rare. The onset is usually sudden, most often within the first 2 weeks postpartum. Symptoms of postpartum psychosis can include delusions, hallucinations, hyperactivity, decreased need for or inability to sleep, paranoia, and difficulty communicating at times. So what do we suggest for individuals with PPD? Make healthy lifestyle choices. Eat well, get adequate sleep, and physical activity. Exercise, once cleared by your doctor, releases endorphins which help combat stress and improve overall mood. Set realistic goals and expectations. You are recovering from a bodily trauma and having to parent at the same time. Do not put pressure on yourself to be superhuman and do everything. Do what you can and come back to the rest later. Make time for yourself. Remember, to take care of your baby, you must first take care of yourself. Do something that you enjoy. And seek counseling services. What can you expect in counseling for postpartum depression? When working with clients experiencing PPD, I use cognitive behavioral therapy, or CBT. This approach helps clients examine their thought patterns and unhelpful ways of behaving. For new parents, expectations for parenting and the pressure to be perfect can contribute to postpartum depression. I will help you examine those thoughts and shift them to more realistic expectations. You can learn to avoid triggers for depression and different ways of thinking and reacting to situations that may trigger that depression. In terms of behavioral change, many new mothers run themselves into the ground as they try to take care of their babies. I will help teach you new strategies of taking care of yourself as well. If you're feeling depressed after your baby's birth, call your doctor and schedule an appointment. You can also reach out to local mental health providers. It is important to call your doctor as soon as possible if your depressed symptoms don't fade away after 2 weeks, seem to be getting worse, or include thoughts of harming yourself or your baby. If at any point you have thoughts of harming yourself or your baby, immediately seek help from your friends or loved ones in taking care of your baby and call 911 or your local emergency assistance numbers to get help. Here are some emergency resources for you. If you take anything away from this video, I hope it is this: having postpartum depression does not make you a bad parent. To join our JCAC community and to make sure you don't miss a new video, like, subscribe, and leave a comment letting us know how we can best support you. We would love to hear from you about topics you'd like us to cover in future videos. To learn about the counseling services we offer, check out our website in the description below. We look forward to hearing from you and seeing you in our next video.